Are you ready to embrace aging with vitality and purpose? Welcome to Essential Wellness. I'm your host, Dr. Mikel Segal. Let's dive in. Hello and welcome again, everyone. So today I'm very excited to speak to Adrienne, who is a physician and hypnotist. And I'll let Adrienne share a little bit more about herself and what she does. So welcome, Adrienne.
Thank you so much, Mikel, for this opportunity. And it's really exciting to share a little bit about myself and about being a hypnotist. I was forced to retire from medicine because of medical issues. I couldn't continue to stand on my feet, but I wasn't ready to retire. And I was looking for a way to continue to work with people and help people. And I met another physician who was actually doing the work. And I thought it was fascinating because before I got there, I started doing life coaching, which I thought was also it's a very powerful way to help people. And as I did that and finally learned about hypnosis, I found that with coaching, which is very helpful, the difference is with hypnosis, you sort of bypass that critical factor, that critical faculty that creates the negative feedback and questions everything and the negative self talk. And I thought, wow, this is more of a direct link into the unconscious mind.
Mhm.
And so that it helps my clients to really get to the root of the root and bypass that sort of negative self talk part.
Mhm.
And so I found it to be really helpful. And it was really exciting to learn that hypnosis was considered an approved medical modality by the AMA back in 1958. And I think most physicians
Wow.
know that. So for me, it was really congruent because as a physician, I was still able to help people in a medical modality and use my training and help people without working as a traditional physician. So it was a perfect match.
Very cool. Very cool. So tell me about the journey, like how you got doing what you're doing right now.
So I went through trying to figure out now how do I do training. So went through Google and there's a whole lot. Some of it I don't know is reputable, some is not, but I didn't know how to discern what was what.
Mhm.
So I went through a woman who wanted to train me in hypnoanalgesia,
Mm.
which is hypnosis, analgesia for pain.
Mhm.
And no, analgesia usually works in a dentist's office
Mm.
and in surgical procedures. And it's very accepted in Europe and the UK. And this individual was from the UK and she was going to train me. And I guess it didn't feel like a good match for me because I'm used to being in direct relationship with the patient or the client, and being an adjunct did not, it just didn't feel right for me.
Mhm.
And I continued to search, found an online train, not, I'm sorry, in person live training. And that was the Mike Mandel Hypnosis Academy, and they're based in Canada. So I went through their training,
Mm.
and it is live for 5 days, like drinking water from a fire hose with
Wow.
practice.
Yeah.
And you learn a variety of techniques, the history of hypnosis, how it has been used historically in medicine, way back in India during the time of the British Raj, all
Mhm.
the way up to present day. So it's a very thorough, in depth training, and they have a wide and deep variety of materials on their website for other things within the range of hypnosis, not like NLP or neuro linguistic programming. And you have to take an exam and pass that exam before you become a certified hypnotist.
Okay, cool. So how do you use it today? Like, how are you using hypnosis with your clients today?
Today, my specialty
Mm-hmm.
is smoking cessation.
Mm-hmm.
It is chronic pain. It is stress, anxiety, and phobias. And I chose those because physicians can refer their clients to me should they choose to. And I
Mm-hmm.
have gotten referrals from physicians for patients who maybe are allergic to certain medications, have been on a lot of different pain medicine and nothing is working, things of that nature. And also, the general public can reach out to me as well. So those are the main things that I work with, but I can work on, things as people come to me as well.
What have you found with working with your clients using hypnosis? What surprised you the most about using hypnosis?
What surprised me the most is that it is nothing like what you see in the media, and that someone is doing something to you or holding something up. And it is really a collaborative, co-creative
Mm-hmm.
relationship where the client is gets decides what it is, what outcome or goal he or she wants,
Mm-hmm.
and we work towards that. It is also, I find it interesting because you can do remedial work. What do I want to change or get rid of, or the weight loss or the pain? But it can also be regenerative. What things do I do well? Do I want to become better at? So it's not just looking at negative things, it's also
Mm-hmm.
enhancing the things that you do well with, or creating things that you do well with, being
Mm-hmm.
more focused, or confidence, or just public speaking, things that skill sets and soft skills
Mm-hmm.
that people can use to enhance their lives and make their lives even better.
What you say is true. I mean, I know a little bit about hypnosis because I've been looking at it recently. I think a lot of us think of hypnosis as like 1, 2, 3, you're getting sleepy, that kind of thing, and have this image of that being what hypnosis is all about. What would you say to people who still think of it like that?
Well, hypnosis, if you think about it, we go through some form of hypnosis throughout our day. Even in medical school, we learn about just before you go to bed and just as you wake up, there are two stages of sleep, the hypnagogic and hypnopompic stages of sleep, which are like hypnosis, which means you're highly suggestible. If you've read a book and you sort of zone out, that's hypnosis. If you've ever watched a little kid watching cartoons or TV and their faces slack and they're watching and they're not even blinking, that is a form of hypnosis. Driving home from work on your usual route and you're talking to somebody or you're thinking about a problem or trying to help a patient and you're not even actively thinking about how you're getting home, and all of a sudden you're backing into your driveway and you can't remember how did I get here, because you were in hypnosis. It's an automated behavior. And even riding on a rhythmic train, looking out the window and you zone out, and it's like daydream. You're not asleep. You're the left side of your brain is more inactive, but it allows your creative right side of the brain to run free and to engage and to co-create all the things that you want.
Wow. Very cool. What's the biggest transformation that you've seen with your clients?
I had a client who was having terrible itching. We were in a group setting and had terrible itching and was itching. I said, like on a scale of 1 to 10, where is it? And he said it's like 9 out of 10, 10 out of 10. And I did hypnosis with him. And throughout throughout the session, it was a something on something else. We continued with what the meeting was about, and at no point in that session did he scratch or mention or look in any way uncomfortable. And then I reached out to him maybe 3 or 4 days later, and he said, "Oh, I completely forgot about it until you just asked."
Wow.
And that took maybe five minutes.
Wow. That's pretty amazing. How has hypnosis and this journey that you've kind of created for yourself, how has that transformed your life?
I would say I feel like I'm a product of my product. When my goal was to become a life coach and really help people, it wasn't the talking to people and having sessions. It was that whole getting people to know who you are, that marketing, social media, putting yourself out there part that really freaked me out. I barely posted. I never got a website. I tried to hire someone to help me on LinkedIn. And that was the main obstacle
Hmm.
that prevented me from really helping more people. I did get some clients, but I just, I was the constraint, the
Hmm.
obstacle, the barrier in building my own business. And now I envisioned the website. I knew exactly what I wanted. Before, I wanted someone to create the website and figure out all the things, but I actually knew what I wanted to communicate and I envisioned what I wanted my website to look like. I knew what content I wanted. I am literally making offers to people, connecting with people in my own community here in Maryland. We have Flourish, which is a series of wellness days, and I am offering group hypnosis sessions in my community. And it's almost like a synchronicity now. You know,
Mm.
things are coming to me that never it was a struggle, it was a burden before, and now I'm not saying it's easy. I
Mhm.
spent about 4 hours trying to figure out how to connect Instagram and Facebook,
Oh, yeah, I know all about that.
but everything is figure outable, and I had to figure it out. So it's definitely different from being an employee where someone tells you what to do. I mean, you're the employee and you're the employer. That's different, but I have more direction and it feels more congruent. It just feels right. Like I'm
Hmm.
doing the right thing, more of what I was meant to do. Oh, because even as a physician, more than titrating medications and let's try this other medication, it was always about connecting with the patient when the door would close and their mask would come down and they would share with me what they were going through in their lives. And very often it was the stuff that they were dealing with in their lives, at work, with family, that was impacting them and manifesting
Mhm.
to some degree, sometimes completely, sometimes to a minimal degree, to the pains or the issues that brought them to the doctor in the first place. And very often listening and being allowing my patient to feel fully heard, fully seen, and to come up with their own solutions without feeling judged or criticized, and just having a real conversation and collaboration, they would find their way
Mhm.
healing in the right path that was right for them.
Right. So it sounds like you get to do a lot more of that now in what you're doing.
Yes, absolutely.
And what do you think when you talk about things are kind of flowing more easily for you and it doesn't feel as hard? What do you attribute to that? What do you make of that?
Well, we're using hypnosis myself, and also because this feels more aligned with what I was already doing as a physician because it's a medical modality. It seems in line with what I've been doing since for the last 20 years.
So one is that you're using the modality and you're getting benefit from it. And then the second is, sounds like you're kind of stepping more into your purpose and your sort of path that seems a good fit for you in terms of helping people and what kind of lights you up.
Yeah. Yeah, because hypnosis is about thought, and if anything, we have learned that everything begins with a thought. This cell phone was a thought first.
Mhm.
So how we feel is usually based on our thought or our interpretation of the circumstances. And by working with that thought or changing that thought through hypnosis to one that actually serves my clients, then that gives them power, not power over, but the power to create the lives that they want.
Very cool. All right. Is there any sort of piece, like what's the most important thing that you want to share with the listeners right now about hypnosis?
I think the most important thing I would want to share is that hypnosis is a natural, normal, and natural state we all experience, but we've never been told what it is. So, when we daydream, we say daydream, but hypnosis, being in a hypnotic state, is very much like daydreaming. It's turning that attention and intention inside to really shift and create. And I invite anyone who's curious to try it, to expose themselves to it. And you can Google hypnosis and pain, hypnosis and surgery, hypnobirthing, hypnodontics. It's amazing. It's amazing. So I would invite anyone or everyone who may feel stuck, asking, why can't I just, what's wrong with me? Why can't I just, I know I want to do blah, 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 but there's a part of me that wants to, and then there's another part of me. If you're having those sort of conversations, to give hypnosis, um, to experience hypnosis for yourself and see what you get, and just be open and curious and allow yourself the experience and grow from it.
Sounds amazing. Thank you for sharing that. And just as we're kind of closing out, maybe you could share with everyone if they want to learn more about hypnosis from you specifically, how they can learn more from you and how they can find you.
Absolutely. And thank you again for the invitation and our time together to talk and just have this conversation. And I'd love to have another one with you offline since
Yeah.
and hypnosis. But yes, the name of my business is Black Swan Hypnosis, and it's about moving through life with grace and power. And the website is blackswanhypnosis.com. And I have finally connected my Instagram and Facebook pages.
Well done.
So I'm on Instagram
Yeah.
uh, and Facebook, Black Swan Hypnosis.
I love that name.
It came to me. It's been amazing.
Yeah.
Things are just
Hmm.
like the channel is open. Like
Yeah.
yeah,
You're in flow.
yeah.
Well, thank you so much. This has been so fun, and I've learned a lot, and I'm sure the listeners have learned a lot too. So thank you for that and for sharing.
Thank you so much, Mikel, and thank you for this opportunity to talk about hypnosis and its use in everyday life.
Thank you for helping others and keep doing what you're doing. I'm sure you're making a big difference. And thanks again. Bye.
Bye.
That's it for another episode of Essential Wellness. If you are enjoying listening to this podcast, please subscribe, like, and share with others so everyone can find us. See you next time.